我去开那个。
A very good morning to you, our viewers. I'm your online host, Edmund. Welcome to the first day of the SATACOM Health Osteoporosis and Fall Prevention Festival from 19 to 21st November. Falls are a common cause of injuries among older adults, and the incidence of falls increases sharply with age. The good news is that falls are preventable through clinical interventions in reducing risk factors. We will hear from our distinguished panel of speakers over the next 3 days about fall prevention, technology, osteoporosis, and other related topics. Our first panelist, Dr. Tim Xu, is an occupational therapy assistant professor at the Singapore Institute of Technology and holds a PhD in health sciences from the University of Sydney, Australia. He has over 20 years of experience working with older adults in both Singapore and Australia. Kindly note that questions will only be addressed by the speaker at the end of this talk. Now, please join me in welcoming Dr. Xu, who will speak to us on fall prevention in community-dwelling older adults, translating research into practice. Dr. Tim Xu, please.
Thanks, Edmund. And good morning to all of you. And first of all, thanks as SATA Health for inviting me to give this talk. The topic today is falls prevention. I think this is something that a lot of people working with older adults are actually concerned about as we are having a rapid aging populations. And just a bit of a background about myself as an occupational therapist. Since I graduated in the year 2000, I've been working with the older adult populations since then. Yeah, so been over past 20 years and fall in love with the topics in falls prevention, right? So hopefully my session today will help you to recap, and maybe you will find this session helpful. All right, so let's start. I will help you to recap some of the common types of falls and update you on some latest evidence in fall prevention and how we can translate evidence into practice, especially in our local context. Well, firstly, let's look at the definitions. WHO defines a fall as an inevitably coming to rest on the ground, floor, or other lower level, excluding intentional change in position to rest in furniture, wall, or other objects. Yeah. So not all incidents actually consider falls, such as sometimes near falls, when people report it, or I almost had a fall, but actually it's not really considered as a fall. But at the same time, people fell, but they never report their falls. Okay, it happens quite often. And as part of the falls prevention strategies, we need to know what are the common types of falls. Yeah, so as you can see from the animation here, sometimes people slip and fall when they're in a hurry, or when their shoes or the ground are too slippery. And people trip on something and fall, especially when they didn't see things clearly, or they couldn't react fast enough to break the fall. And in this case, this old man actually tripped on himself. And many of the time, people taking stairs or steps, and they actually miss the steps and they couldn't balance themselves. Or sometimes people fell off because of that risky behavior. So falls are the leading cause of injury deaths for those over 65 years. And 1 in 3 older adults fall each year. That's the international figure. And the number of fallers actually increase with our age. And almost like 1 in 2 elderly above 80 years old actually fall each year. And what about falls in Singapore? It looks like we are doing better with approximately up to 20% in Singapore and as well as in Asia. But I always have these questions.
Sorry, Dr. Tim Xu.
Yes.
You haven't shared your slide.
Oh.
Yeah.
Okay, sorry. I'm managing my multiple. Maybe okay. Well, that's my big mistake for today. Okay, I try to adjust my screen again. All right, yeah. So perhaps maybe I'll just quickly recap. All right, I think this is important. Yeah. So just now I was sharing the animations. Yeah. So people slip and fall. Yeah, and the impact can be great. And people trip on something and falls when they didn't see things clearly, and also they didn't react fast enough. You know, this is an older adult actually tripped on himself, and people missed the steps, yeah, and couldn't balance themselves. And we consider this as a risky behavior, especially climbing up to a high surface or didn't lock the wheelchairs. It happened all the time. And I just shared about the number of elderly fallers worldwide. Okay, the figure is 1 out of 3. And in Singapore, of course, yeah, the number of elderly fallers increases when they age. But in Singapore, the percentage actually is close to 20% only. And this is also the general findings from the Asia region. And my question just now was here, right, is are we underreporting? Yeah, because especially Asian older adults, they try to hide the secret, okay, and they don't want people to know that they are falling. So yeah, many of the time people never report the fall until their loved ones found out that they're bruises. So sometimes a single fall maybe, you know, doesn't cause serious injuries, for example, fractures. That's why they say, oh, it's fine, you know. I think when I get old, I will definitely fall. Yeah, but falls can also lead to many other consequences. Yeah, besides injuries, it also affects their balance and mobility, and more importantly, their self-confidence and ability in self-care. And people after fall often experience loss of occupational roles and reduced quality of life in the long term. So a large group of older adults after having falls, they develop fear of falling. And this further limit their activities and social participations. And sometimes they just stuck in this visual cycle and with increasing risk of falling. So our job as a healthcare professionals or healthcare workers or non-healthcare workers working with older adults at risk of falling is to how to break the visual cycle. So to help older adults prevent falling, early identification of people at risk is the key. Let's look at the risk factors for falls in older adult population. And there are many research papers actually highlighting, you know, what are considered risk factors, and many papers actually split them into 2 categories: intrinsic factors and extrinsic factors. So in this Deandra's meta-analysis paper, actually is one of the best research paper highlighting the a list of 4 risk factors, and I'm actually including some of these risk factors with odds ratio more higher than 1.5 as considered highly associated risk factors in older adult populations. So something like under intrinsic factors, history of falls, Parkinson's disease, dizziness and vertigo, depression, history of stroke, physical disability, fear of falling, and a poor self-perceived health status. And under the extrinsic factors, such as use of walking aids or use of anti-epileptic drugs. And of course, that doesn't mean other risk factors with odds ratio smaller than 1.5 are not important, right? These like age, female gender, living alone, disability in self-care, cognitive impairment, pain, urinary incontinence, or hypotension. Yeah. So another extrinsic risk factor is environmental hazards, which contributed to 22% of falls. And I did a systematic review and a meta-analysis a few years back on the risk factors for falls in community stroke survivors. And that's another clinical interest. And many fall risk factors in stroke populations are similar to general older adults. And you can see that the odds ratio is much higher. And that also reflects that stroke survivors had a much higher risk of falling in comparison to general older adults. And a lot of falls actually happen within the first 6 months after discharge from the hospital, post-stroke. And for those stroke survivors with a history of fall, their fall risk is 4 times higher than those without a history of fall. So it looks like the falls in older adults are multifactorial, and this is true, which make our falls prevention and intervention more complex. And then we need to conduct a comprehensive assessment to identify people at the risk so that we can determine what kind of interventions and what kind of programs are most effective for this group of population. So let's take a look at commonly used fall risk assessments. The first one I would like to introduce is a FROG-COM. It's an assessment tool that involves rating 13 falls risk factors listed in this slide. And a total of score higher than 18 is considered at a high risk of fall. And this tool is commonly used in many community settings overseas. And I think it's been used in some community settings locally. And it's a multidisciplinary approach, right? It's not just used by a single healthcare professional. Another one is a fall functional reach test. It's one of the most commonly used physical tests to look at people's balance. And a score of 6 inches or less indicates a significant increased risk of falling. So what you need is just a measuring tape. Place it on the wall and ask the older adult clients to reach forward and measure the distance. Another one also commonly used in our local setting is called Short Physical Performance Battery, in short SPPB. Actually highly recommended by Health Promotion Board. It consists of 3 subtests: sit to stand, balance, and the walking speed. And people with SPPB scored less than 6 out of 12 will have a higher fall risk. Time up and go test is another quick fall risk screening tool. Older adults taking longer than 14 seconds are considered at a high risk of falling. Another tool probably can consider is the ABC scale. ABC stands for Activity Specific Balance Confidence. It assesses people's confidence level in performing self-care activities. As you can see from this form, the client needs to rate the level of confidence from 0 being no confidence to 100% being fully confident. And if the total score falls below 67%, he or she is at a risk of falling. Falls Activity Scale International is a 16-item scale assessing people's self-efficacy or /confidence in performing daily living activities. And people scores 28 and above will have a high concern of falling, and therefore it's at a high risk of fall. Likewise, any score lower than 20 will be considered at a low risk of falling. And the falls behavioral scale is another of my favorite tools. It helps to identify people at the risk, whether they are taking any risky behaviors in doing their daily living activities. Like what you can see from the slides, we don't want our older adults like Mr. Bean, okay, rushing through everything. And the beauty of this form is that every question actually is relevant to our day-to-day activities, and we can actually use that as educational tools when we notice somebody is taking risky behavior in performing, for example, standing up quickly, okay, from a chair, or picking up things without hand support, like the picture shows on the right. And then we can educate people how to avoid performing such risky behaviors. Another one is called the Balanced Recovery Confidence Scale. perhaps is very new to all of you because we are still undergoing validation. And my colleague is leading this project. And the purpose actually is to look at how people react to loss of balance and prevent falls, and how confident they are to prevent falls. So we actually included 19 items, and each item will have a picture to illustrate the activity for easier understanding. And also for information, by looking into different stages of falling, we hope that more tailored interventions can be assigned to older adults with different level of falls-related self-efficacy. So yeah, we hope that these BRC tools will be validated and out soon for clinical use. So after risk identification or knowing someone at risk of falls, and we definitely have to think about what programs or what interventions are effective in helping our older adults reduce falls. So here are some evidence, and along the way, we actually look at what actually is the most effective interventions in falls prevention in older adult populations. So since I mentioned about environmental issues contributing to 22% of the falls in older adult populations, and home safety assessment and modification interventions are found to be effective in reducing falls by 19%. Yeah, so this actually was from the Cochrane reviews published in the early years. And more importantly, the home safety and modifications interventions were significantly more effective when they were delivered to those at a higher risk of falling, or when they were delivered by an occupational therapist. And this was further supported by another randomized controlled trial study published in Lancet, one of the highest impact factor journal. Home environmental modifications increase the effectiveness of multifactorial interventions for reducing fall risk and injuries, and should be recommended as part of a comprehensive fall prevention program or strategy. This forest plot shows the pooled results from the randomized control trials testing the effectiveness of the one-to-one home-based exercises and group-based Tai Chi program. And both are effective in falls prevention. And this, the upper portions also included the Otago exercise programs. The 3 studies actually published in the late 1990s and early 2000s. Yeah, so I will introduce Otago exercise in my subsequent slides. Another interesting finding from a recent meta-analysis study is that in at-risk older adults, Tai Chi practice may reduce falls over the short term, like less than 12 months, by approximately 50%. The effect in falls education decreases when it's in a longer term. Yeah. So I would like to introduce 3 falls prevention interventions or programs that have been shown to be most cost-effective in reducing falls in community living older adults. So this is actually a paper that was presented to CDC, United States. And the first program is Otago exercise program. Actually, it consists of 17 strength and balance exercises, and including a walking program as well. And performed 3 times a week by older adults in the home or the community setting. And exercises can be done individually or in a group setting. And the study also demonstrated these Otago exercise programs can reduce participants in fall rate by 35 to 40%. The Tai Chi program called Moving for Better Balance is a unique combination of 8 single forms, largely derived from the traditional 24-form Yang style. There are many styles in Tai Chi, originated from China. And Tai Chi has been considered a low-cost exercise activity because we don't really need any equipment, and fewer facilities are needed. It can be done actually anywhere. And in this program, all participants attended 2 sessions at the center and 30 minutes self practice at home each week. Yeah, so this is how this modified program actually was conducted. And it's rather simple, and you can see there are a lot of weight shifting and focus on that in the balance and the core muscle group. Another program I would like to introduce is the Stepping On program. And this Stepping On program is a multifaceted group-based falls prevention program. It adopts the adult learning principles to promote positive behavioral changes, resulting in reduced fall rate by 31%. And the program actually is running widely in Australia and the United States. So this program covers a 7-week group-based intervention, focusing on various fall prevention topics, facilitated by a trained program leader. And in between, the program leader will invite different content experts, such as physiotherapists, pharmacists, dietitians, and of course, there are occupational therapists. If the program leader is not an occupational therapist, to give fall prevention related content in a more interactive manner. And this program is followed by a home visit 1 month after as part of the follow-up. And there's also another booster session 2 months after the home visit as part of the follow-up. And of course, there's another phone call 6 months after the 7-week program. So while most interventional studies were conducted in Western countries, and what works in Asia, and the Prof. Case Hill from, I think he's now in Monash University, Melbourne, he did a systematic review and the meta-analysis in 2018. And the total number of interventional studies in Asia was small. That's why making it difficult to generate conclusions. But nevertheless, the paper concluded that exercise interventions are effective in fall prevention. And multifactorial interventions and the multi-component interventions had some positive falls outcomes. But for multifactorial interventions did not reach a statistical significance in terms of the number of fallers. Yeah, so people may still fall, but maybe the fall rate could be reduced. That's in Asia. But what about Singapore? All right. So I believe our government actually is doing a great job, especially we have the national fall prevention campaigns led by Singapore Health Promotion Board, and also in collaborating with many key stakeholders, including hospitals and the community service providers. And by comparing to 20 years ago, I think that public awareness is much greater. All right, people know that older adults are at the risk of falls, and the family members actually are more aware of that. So this is actually a very positive outcome from the national falls prevention campaigns throughout the years. And in the clinical settings, I think if you are working in the hospitals or community rehab settings, community aged care settings, we know that we have a group of therapists who are dedicated enough to look after our patients who are at the risk of falls. So falls assessment is actually part of their clinical work at the early stage of rehabilitation. And for example, OTs, we do a lot of home visits. And help our seniors to identify potential home hazards and prescribe aids and appliances such as commode chair, shower chair, or other aids and assistive devices like long-handled reacher, yeah, and non-slip solutions for their shower room and toilet, and also suggest for grab bar installation. All right, so these are important features for homes to enhance home safety. And of course, what we hope after our home visit is that their family members or even the clients themselves actually taking our advice and then make their home safer. All right, so that's our hope. But from what I understand, sometimes we give advice, but not everyone actually is taking our advice. Yeah, and since HDB launched the e-scheme, more households with seniors living in together had environmental modifications done to make their home safer. So 3 items that includes grab bar installations, anti-slip solutions for the toilet and shower room, and ramps for wheelchair users. Yeah. And our digital colleagues are there to help our seniors to regain their balance and strength and teach them skills like how to walk safely. Yeah. And I believe many other colleagues like dietitians, they are looking after people's healthy diet, especially in the area of calcium intake and vitamin D from natural sunlight. And all of us actually we're so used to conduct fall prevention talks in the past, especially pre-COVID-19. Yeah, and this is part of the public outreach to raise awareness, I guess, because health talks already been proven not effective in falls prevention. Yeah, if it's a single approach alone. And currently, of course, we still continue doing a lot of public outreach, but via virtual platforms. Yeah. So this is actually the new normal that we probably have to continue with, maybe for the next couple of years. And it seems like we are doing a great job in Singapore to help older Singaporeans reduce falls. And my question is, are we delivering all these interventions to our seniors, and are they effective? Okay, so this is my question, because as a clinician and a researcher, now I always ask myself, is this going to be ineffective? Okay, how can we do better? All right, so with these questions, of course, I always curious about what we do in the community and what we can improve. So for this instance, I would like to highlight that since now this is a public event, okay, if you do notice someone who received a RAM, aluminum RAM from HDB scheme, and perhaps they might need it when they are still at the early stage of recovery, when they are on a wheelchair, you know, after falls or with fractures. But if they started walking, and this may impose another risk because of the uneven floor. If they step on it without a proper handrail, they may lose balance easily and fall, right? So are there people actually following up with the HDB East application, all right? And of course, I did a lot of home visits in my early days. And my question is, do we really need, you know, so many grab bars for one household? You know, sometimes it can be unnecessarily, you know, if we have so many grab bars in one house. And after all this are our taxpayers' money. And whatever we educate, whatever we suggested or recommended, so did all our clients make the recommended changes? So here, the keywords here is about behavioral changes, all right? With those questions in my mind, when I started my PhD journey, I actually, brought this Stepping On program to Singapore in 2016. Actually, I started my PhD in 2015, where I met my research supervisor, Professor Lindy Clemson, who is the first author for Stepping On program. And she developed this in early 2000. And the first RCT paper published in 2004. And of course, Megan Swen is another, is a co-author for Stepping On program. And actually, I went to Megan Swen's hospital, undergoing training to become a Stepping On master for Singapore. Yeah, so I actually prepared a short video clip for you to understand this Stepping On program.
The Stepping On program is a multi-component falls prevention program proven to be effective in helping community-dwelling older adults reduce falls. It was developed by Professor Lindy Clemson in Sydney in 2004 and has been widely implemented worldwide since then. It was first introduced by Dr. Tim Xu in Singapore in 2016. The program covers a 7-week group-based intervention focusing on various fall prevention topics facilitated by a trained program leader. As part of the weekly session, participants learn balance and strength exercises from an exercise specialist such as leg raise, heel raise, hip strengthening exercise, sit-to-stand, tandem stand, and tandem walk. Participants also learn from the expert how to walk about safely, such as crossing a step, walking up the stairs, and how to get up from the floor after a fall. In one of the sessions, the occupational therapy expert explains the potential home environmental hazards and discuss strategies on how to make their home safer. During the program, participants have a chance to practice mobility functions in the community as a small group and develop ways to keep them safe when going out. They also have a chance to assess their footwear and learn how to choose safe shoes before going out. Since many older adults fall because of their poor vision, they also learned from an eye specialist about common eye conditions and the importance of having a yearly eye checkup. Participants also learn from the invited pharmacist about common medications that may increase the risk of falling and the importance of getting their medications reviewed by their doctors regularly. A dietitian is also invited to introduce healthy eating and ways to get sufficient calcium from natural food, as well as vitamin D from the sunlight. At the last weekly session, participants recap what they learned from the program and receive graduation certificates from the program leader to celebrate their achievements. All participants will be offered a home visit by the program leader 1 month later to check on their strategy implementation and the challenges they're facing. Lastly, all participants will be invited to attend a booster session 2 months after the home visit to help them recap the main learning points and set new goals. The program uses adult learning principles to help older adults in a small group to learn different falls prevention strategies and encourage behavioral changes in everyday life. Participants in the first pilot had a high attendance rate. Most participants had enjoyed the group sessions and benefited from the program. Let's hear from some local participants from the piloted Stepping On programs.
就是为了要使我们身体比较健康，所以我来参加这个运动。参加了以后呢，身体会比较像是舒服一点，又比较没有疲倦的感觉。
我来学这个是说强壮骨骼啦，防止跌倒这些。
我这脚哦，上次走啊15分钟我就要找地方坐，现在但是我就不用，可以走到。在家里户外我会小心很多，我也知道放慢地我就不走，让我的女儿放风扇吹干了，我才出来走这样。
可以走 可以坐了可以站起来了，现在 OK 了，站着就起走了跟我朋友讲，叫他们要做这种运动，走路不大好像很怕跌倒一样。然后我来学了这个运动，走路也比较轻松，不会很重这样。来参加了，觉得很好，脚也是有力了，走路也会比较稳。又参加这个预防跌倒啊，叫我们不要穿拖鞋啊，要穿防滑的鞋啊，不要爬椅子啊、拉梯啊。
我的朋友如果是这样的情形之下，我会叫他们来参加。
那么我会介绍给那些朋友，我会推荐我朋友来参加。
Okay, so this a group of participants actually mainly from the first pilot in 2016, and we had some positive outcomes from the participants. So for example, they demonstrated safer behaviors in performing self-care activities 1 month after the program, and they were also more confident in self-care and better self-perceived general health. And we were glad that the first pilot was quite successful, and most participants did not miss all the weekly sessions. And 4 participants actually signed up as fall prevention ambassadors at Occupational Therapy Day 2017. And they actually participate in door-to-door home visits to promote increased awareness about home safety in North area. But unfortunately, we also had 2 participants had a fall out of the 7 participants that have been followed up during the follow-up period. And I managed to adapt the original Stepping On program to a stroke version, as that's part of my main PhD. The Stepping On After Stroke program, and now I actually call it a CREATE program. It's a community reintegration after stroke program. It is feasible to implement this program in Singapore, but must consider the following factors, such as must involve the caregivers and family members, especially for stroke populations, and program leader competency is another key factors, and the organizational support and the logistic support is important too, in order to run a group-based interventions. So as part of the recommendations, I would like to recap some common key elements in evidence-based fall prevention program. For example, the program should be well structured, targeting at modifiable risk factors for falling. To make the program work, it should be community or home-based with a progressive physical training component. The program should be led by a trained program leader to promote positive behavioral changes. Lastly, checking on their weekly homework can improve the compliance on the recommended exercises as well as other activities by the invited experts and the program leader. By adopting the evidence-based approach, we should design and deliver effective interventions to help our older adults at fall risk to achieve their desired outcomes, not just about reducing falls, but also increasing their community participation and the overall quality of life. So while technology is evolving in the healthcare industry, we can tap on the existing ones when delivering our fall prevention interventions, such as wearable personal alarm systems or even step trackers can help us to detect their amount of steps they accumulate every day. And there's also hip airbag in the market, but maybe not locally yet. Yeah, so this has been shown quite effective in reducing the risk of hip fractures. Just recently, and this actually was published in Zaobao a few days ago on 15 November. And locally, we are also trying to develop another version of a hip protector that is suitable for Singapore climate and to reduce fall-related injuries among older adults at the risk of falling. And of course, I understand that many hospitals and clinical settings do have this sensor mat, especially for people with cognitive impairments. Tele-rehabilitation has becoming part of our day-to-day clinical work in many aged care settings and the rehab settings. We can consider incorporating such technology in falls prevention too, especially experts may not be able to make it physically. So we could actually do it via virtual platforms like Zoom or Microsoft Teams. And for instance, we actually tried the hybrid version late last year, and where some participants actually attended the session at the center, and some participants joined the session at home via Zoom. Though there were some technical issues, for example, connection issues, or maybe unable to see the video clearly, but we managed to sort it out, for example, by testing it before we start the session, or adjusting the lighting so that we can see video clearly. And we managed to actually complete the mock-up hybrid programs together with our potential program leaders. So the reason why we conduct this is also part of our program leader training, post 3-day workshop, getting ourselves ready for the stepping on pilot in the north area in 2 weeks time. In fact, actually the first group we're going to start is actually 29th of November. And for information, I've conducted many program leader training workshops in the past to train healthcare professionals, and also including non-healthcare professionals like therapy assistants or care coordinators, and also included some peers to become peer leaders, ready for some of my initiated community-based programs such as Stepion programs, community reintegration after stroke program, the CREATE program for stroke populations, and Say No to Frailty program for people with frailty. And of course, you can find out more about Stepion program from this website. And this is my contact. So let me know if you have any other questions. So I think I will end here. Yeah, thank you for your attention.
Okay, thank you, Dr. Xi, for your most interesting presentation. Okay, thank you, viewers, for joining us at this session. Do check out our other webinars over the 3 days of this festival. Thank you.
So are there any questions before I leave? Okay, so there are few questions. Okay, in the Q&A, let me quickly answer these. Stepping On program currently is still under pilot, and once we started implementing, it will depends on each individual service providers. Yeah, so it is group based. Definitely, some centers say they want to offer it free of charge, and some centers maybe they want to charge maybe a couple of dollars to cover the administrative costs. Second question is about age criteria. For Stepion program, at the moment, we are actually looking at people who are above 65, but in Australia and the United States, they actually lower down to 60 because some people may develop, risk of falling. So yeah, so probably check out when we started the programs. Yeah. How do we sign up the programs? Definitely, you can come back to this website again for latest updates. Because okay, I just share my screen, okay, so that you can take down the address or just scan the QR code. I will definitely put up all the latest updates on which center will offer stepping on program in the near future. Yeah. Okay, yeah, so I hope I answered some other questions asking for website, payment methods. Where can I find out more about these programs? I'm not sure which programs you're referring to, LinkedIn. Okay, so how to be a trainer? So you have to contact me and I will probably give you the dates for the upcoming training workshops. Yeah, so it's a 3-day training workshops, and it will be back again under SIT Learn. So as long as you are Singaporeans, we have a Skill Future fundings to support this training workshop. Okay, so the last questions, can the medicine of atrophic spoil the stomach? Sorry, I'm not a pharmacist or I'm not a medical doctor, so I can't answer these questions. But what I know, okay, personally, I know all medications will have side effects. Yeah, so do consult your medical doctors or pharmacists when you're taking the medications. Ask what kind of side effects, okay? So this is something that I learned from my pharmacist colleagues. It is important to know the side effects before you're taking the medication. Okay, so there's a few more questions in the chat box. Okay, so yeah, some people asking for my email. Yeah, this is my email address. Let me see. Could not move, so is non-slip slippers dangerous? Okay, we're talking about non-slip solutions. If someone had a stroke, for example, with foot drop, and this might be an issue, they shouldn't wear anti-slip footwear because it will increases the risk of tripping, right? So it really depends. I think for the individual unique cases, you have to bring your loved ones, your parents or grandparents to nearby rehab centers for assessment. I think the therapist over there will help you to do a comprehensive assessment to help you identify the risk. That's number one. Number two is to educate you about how to go about preventing falls. Yeah. And another question about age. 55, will be staying alone soon. Can I get someone to come over to view my house? Okay, so well, you probably have to contact the centers nearby, or if you want to contact SATA Health, I know they have occupational therapy services. So definitely you can look up, yeah, for centers nearby or call them up, okay, inquiring about occupational therapy services for home visits. Yeah, another question, may I know how to enroll in the workshop? All right, so please email me if you are interested to become a program leader. And because we do run these programs periodically, but because of the COVID-19, we kind of paused for quite some time and are now restarting. All right, so I will put up some dates very soon in SIT on the SIT website. Yeah, so please email me and I will keep you updated. Can I repeat about the non-slip slippers? Okay, so this is to answer this evening's question. For people with foot drop issues or even Parkinson, people with Parkinson's disease, they tend to trip very often. Yeah, so therefore non-slip slippers actually can be dangerous. But anyway, slippers can be dangerous, okay, if you are wearing it while going out. And I would suggest non-slip slippers, for shower room use only. Yeah, otherwise slippers can impose a danger for older adults, especially with balance and gait balance issues. Yeah.
Okay, thank you, Dr. Xi.
Yeah.
If there are no further questions, thank you, viewers, for joining us at this session, and do check out our other webinars over the 3 days of this festival. If you'd like to receive Dr. Xi's slides, please email your request to mediacontact@sata.com.sg. I repeat again, mediacontact, one word, @sata.com.sg. Okay, thank you very much.
Okay, bye-bye everyone. Stay safe.